Death is being marketed by euthanasia advocates. They are misrepresenting their true goals. There's a world of difference between helping someone as they're dying and causing them to die. For more than 2,000 years, the Hippocratic Oath has been a protective shield for the patient and the doctor. And it's protected society from the inevitable floodwaters that come once we open the doors to legalized killing. We know that people in emotional or physical pain may often express a desire to die. But what that is a cry of help. It's an invitation to us not to kill them, but to get involved in their lives. We've seen that in Holland, they've opened a Pandora's box, and now that box can't be closed. We know that suicide and thoughts of suicide can themselves be contagious. And where assisting suicide is legalized, death will itself become a very effective salesman.
I gotta ask you about something that you said in there. HMOs are shopping around for doctors that'll go for this? Is that happening?
Well, there's one of the major HMOs, and they circulated an email among their doctors indicating that they couldn't find enough doctors to do it, and they were asking doctors to come forward that would be willing to write the prescriptions because they weren't getting enough to.
Do you think the average person watching this show right now understands everything that's involved with the motivation behind this movement, this law?
I don't think so, and I encourage people to learn as much as they can. What I have learned is that the more we can talk about it, the more people will see the harm and the dangers.
Well, I think it's such a disadvantage for people because let me ask you this, how many times has the front page of the local paper said the bad side of assisted suicide and featured somebody? How many?
Rarely.
Yeah,
rarely.
We don't have a stack of those, do we?
But one of the interesting things that happens is that these articles that come out tell us the things that are harmful about it. The instance of Mrs. Lavelle Svart.
Right.
I think that was very strange to me. Again, I've been a doctor taking care of a lot of patients that are dying.
Right.
She was not dying. She was not close to dying a natural death. She was probably many weeks, maybe even months away from that. One of the things I have learned is that you cannot always tell when a person is terminal.
No.
I've had patients that have come to me or been referred to me with, say, lung cancer. The lung cancer is spread to the brain. The doctor has told the patient, you're terminal. And I've had a number of patients where I have treated their lung cancer, treated their brain tumor, even when they have that. And one I remember in particular lived 2.5 years, very well. He saw 2 grandchildren born that he would not have.
I think that's so important to say that.
Another woman was referred to me with a colon, or like a low rectal tumor, and she was referred, and the tumor was actually such that we could treat it with surgery. We could treat it without surgery. We could treat it with radiation and chemotherapy. I told her the likelihood of her being cured was about 70–80%.
Wow.
She said, "No, I want to wait until I'm eligible for this as a suicide." And I said, and she'd really made up.
And why do you think that
she'd
is?
made up her mind. She had cancer. She just thought that cancer was a bad thing. And I said, "Would you be willing to come back next week?" So he came back next week. She still refused treatment. She did that 3 or 4 times.
And what was her age?
She was in her 50s.
In her 50s?
In her 50s. And finally I said, "Tell me about your family." And she said, "Well, I've got I've got a son in his 20s, late 20s. He's not married." I said, "Wouldn't you like to see him get married?" "Yeah, I could do that." And she said, "Well, she received treatment with radiation and chemotherapy. The tumor melted away. She did not need surgery. She did not need to have a colostomy." About 6 years later, my wife and I were in a restaurant. This woman came up to me and said, "Dr. Stevens, you saved my life." And this was like 6 years later. And I could.
6 years later,
6
this
years.
woman is in a restaurant?
Yes, she's cured.
I don't believe
she's cured.
it.
She's cured.
She's cured.
Yeah.
And
But when I first saw her, her desire was for the assisted suicide because she had cancer.
And
she wasn't eligible.
She was afraid.
She was afraid of what might happen. And again, the purpose of a doctor is to explain to the patient the reality of, cancer is not a good diagnosis.
Right.
And there are different prognosis of different types of cancer.
Everybody's different.
But you need to, we really should be trusting our doctors. One of the things I have sort of considered in this is that those people that say that you need to have this law because the doctor can't take care of you, can't take care of what may happen to you. What they're really saying is that the doctor can do a better job of killing you than caring for you.
Ooh.
And so what we're going to have is we're going to have a society where, if that were really to come to pass, we will have a situation where the ability of doctors to take care of things. In fact, one of the things I've learned, in fact, there are a number of instances of this where when you have assisted suicide available or euthanasia available, and this has been both in Oregon and in the Netherlands, there's actually a decreased incentive
to manage pain.
To manage and to find a solution for it. There was a doctor in the Netherlands who was a consultant to other doctors that do euthanasia, and one of these other doctors called him and said, I have a patient who has a bowel obstruction. In the past, I've always dealt with this by euthanizing him, giving him a lethal injection.
Oh, right.
This patient doesn't want that. What do I do? Well, this doctor had lost the ability to take care of a patient with bowel obstruction.
What you want to do is make sure the person out there that is maybe wrestling right now with an upsetting diagnosis, maybe a terminal cancer diagnosis, or a family member, you want them to know that assisted suicide is not the way to go because
the purpose of medicine is to really take care of a patient. There was a famous doctor, Francis Peabody, 80 years ago. He said the best way to care for a patient is in the caring of the patient. You care for them. And we have increasing abilities to take care of pain. We are not aware of any patient who's really had uncontrollable pain that has died of assisted suicide. They're doing it because
and I think that's important to bring up.
They're tired of life, or they've been controlling people. They have been in control of their life. They want to be in control of their the
type
death.
A personality that says, I'm going to be in charge till the end and you're not going to stop me.
Yeah.
And I was going to say, what's wrong with
they look at hospice, they look at palliative care as getting in their way.
Okay.
Because they want to do it. They want to be in control of that.
Well, as far as people being fooled, which we've talked about, into thinking, I'm doing something really nice for my loved one if I go along with this idea, or even so if I encourage this idea. And I want to read some of the words that they have used, words that cover up what we're so against. Death with dignity. Let people die. Helping people face death. Helping people deal with their death. Compassion in dying. Easing their burden and helping people. Basically, they want to keep saying the word help.
Right, and one of the in fact, the medical director of the assisted suicide organization in Oregon says it is healing. I am healing.
He said it's healing.
She, a woman, she said, I am healing the patient when they die.
When they kill them.
Yes.
It's
a form of healing.
I guess it is. One way to say you're cured
it's double speak.
Is you're dead. Yeah. And they say this with a straight face. Yeah. I can't believe these people actually say this with a straight face, that killing someone is healing them.
That's why I felt the medicine really turned upside down.
I think you're right. I really do. And I know this gets very personal for you. And you shared that on your website. I can't say enough about your website. It's absolutely phenomenal. Education doesn't even be able to describe it. But if you don't mind sharing your very personal story with us that you shared on the website for people, I think it will help.
Okay. Well, this actually occurred 12 years before Oregonians voted on assisted suicide. This was in May of 1982.
Okay.
And my wife and I had been married for 18 years. We had 6 children. And she had had cancer. She had a lymphoma, cancer of the lymph nodes, that had started in a lymph node and over a 3-year period had eventually spread to her brain, to her spine, to her bones. So she had a lot of treatment with chemotherapy, with radiation.
Right.
And we finally went to the doctor again in late May of 1982 and said, what more can be done? She was on pain medication, she was on antidepressants, she was failing physically, she had lost a lot of weight, and it was really evident that there was really nothing more curative type that could be done.
Right.
It was
as far as chemotherapy,
more
or
just keeping her
radiation.
comfortable. And I guess I say she was on pain medication and sleeping medication and antidepressants. And as we were about to leave, her doctor said, "Well, I could write a prescription for an extra large amount of pain medication." It was very subtly said. He said, "No, we've got sufficient pain medication." And as I helped my wife to the car, she said, "Ken, he wants me to kill myself." And it just devastated her. It devastated me that her doctor, her trusted doctor, would. It was very subtly said. And again, this is before we had legal assisted suicide.
Okay.
And it made me realize
I can't believe
the
it.
importance of trust between a doctor and a patient. A doctor would very subtly say to a patient, "I can give you a prescription that you can use to cause your death," without really saying it. I mean, it was very,
of course, the implication was there,
very and so she
picked up on it.
She had had a lot of suffering, but that experience was probably the greatest suffering that she had. That her doctor, her trusted doctor, would feel that her life was no longer of value.
He wanted to quit.
Yeah, I think he was, and I think that you also have to be aware that doctors sometimes tire of patients.
Well, you bring that up too very well.
When you can't cure.
Yes.
It's
exhausting taking care of
breast
complex.
We have races for the cure of breast cancer, but we don't have races for the palliation of many things.
You're right.
And well, about a week later, she died in our home, and it was at peace. She was at peace.
Well, I'm glad she had you for a husband. I'm so sorry for your loss of your wife, and I thank you so much for sharing her comment, because I think that comment means a lot. It means what your doctor says to you is so important, and if somebody
we mirror what other people
and you take it as
or do,
it's very hurtful.
Their behavior.
And if somebody out there has a doctor making a suggestion like that to them, what should they do?
They should seek another doctor.
I love it. Say it again.
Seek another doctor.
Thank you.
Seek a good doctor.
You have his permission. You have Dr. Stevens' permission. Get out of there.